You guys, it's my week 28 update, which means that I'm in the third trimester right now. So let me get into it. Week 28 snuck up on me. I guess I didn't even realize I was in the third trimester until I opened my app that morning to see what weird animal the baby is supposed to be the same size of. One of the big things about week 28 that was different from previous weeks was the amount of heartburn I had. It wasn't a lot and it wasn't unmanageable by any means, but it was very noticeable and it was much more frequent than it has been in the past. I've been really lucky and I've only had small bouts of it here and there, and a lot of the time it would make sense. It would be like, well, I did have, it's almost always like red sauce, pasta sauce or pizza sauce, which I don't eat very often, so when I did, I'd get heartburn and I'd think, okay, that makes sense. But in week 28, it was more consistent that I was getting it for no apparent reason. But it's nothing that a couple of Tums didn't take care of, and it wasn't anything to keep me up at night or anything like that. So I really can't complain about that. Now, one thing that I could complain about, which if you had asked me in week 28, I probably could have gone on for 10 minutes complaining about this. Just because it's something, it's not pregnancy related specifically, I wouldn't say. It is definitely something I've done in the past, but I think it's just because of stress or exhaustion. I don't know. I don't know what causes it, but I want to punch myself in the face when I do it because I'm so frustrated by it. In week 28, I had it a lot because, and I know that this is why, my week 29 and week 30, I had a lot going on. I had a lot of obligations and plans and appointments, and I was stressed. The problem is none of it was bad and none of it was worth stressing about, but I was feeling like I didn't know where I was going to fit in things that I needed to do, just housework and laundry and working. It was starting to pile up and feel like I had too much going on. And even though a lot of that didn't happen until week 29 and 30, I was already aware of it and already stressing out about it ahead of time. I guess that's just something I do. So I love a clear calendar. I know that might sound rude. I hate looking ahead and having just a schedule peppered with plans. Even if it's good stuff, even if it's stuff that I want to do, it bothers me. I don't know what it is. I get mad and grumpy and stressed, and I just love to look at the whole upcoming week or month, if it's possible, and just go, look at that, I don't have anything to do. Because I know I'll do stuff and I'll fill it up, but I hate feeling like it's all, like the path is laid before me. I don't know. Please back me up if you know what I'm saying, if you know what I'm talking about. So anyway, this thing that I was doing in week 28, which did carry over into week 29 quite a bit, was as I was laying down at night to fall asleep, sleep that I was looking so forward to and really felt I needed, I would wake myself up or just not even be able to fall asleep because I'd start humming or moaning. And I know that this is a sign that I'm really, really tired, exhausted, mentally and physically. So I know that this isn't anything that I could help. And it isn't because I'm pregnant that it was happening, but it was just one of those things where it was like, this is the last thing I need, is to not be able to just rest and shut my brain off. And so I lay down and put my head on the pillow and try and get really comfortable. And I just feel, it was just like, I don't know how to explain it. It's not snoring. It's basically just humming or like moaning. So I start to close my eyes and fall asleep and I go, and that would wake me up. And then I get mad that I did it. And I try to rearrange the pillow and move my head and reposition myself. But it has nothing to do with the position I'm in. It's just something that I do. And some nights I would do it 30 times, 40 times. I'm not exaggerating. Every time I did it, I'd get mad for a second and then I'd try to immediately go back to sleep, and it would happen again, and it would happen again, and it would happen again. And I started like losing my mind over it. Sometimes I would just get up and go to the bathroom and then come back to bed and like roll to the other side or do whatever I could, but it was so annoying. And I probably did just go on way too long about it, but If you have ever done that before, you'll understand why that was something that I had to put on the list, because it was just something that was going on. Oh, thank goodness it seems to have stopped. Oh, that's so bad. I am a little bit scared that I'm going to do that once the baby's here, and you know, if I'm really sleep deprived, or if I've had a long day, or if she has had me up several times during the night, that the times when I am able to lay down and go to sleep, I'll do that. I'm really nervous about that, but we'll worry about that when we get there. Another thing that was happening a lot in week 28, which I believe was mostly at night, I would really notice it in the evenings. I don't know if my bladder is more full then, or if I'm emptying it less frequently, but I would notice, you know, sort of if I had some time with Mike and would kind of sit on the couch for like an hour and have dinner and watch TV before bed, I would notice that my bladder was being kicked or punched. And it was, the only way I can describe it, because I've heard people, obviously, it's something you hear about a lot, is that people will say that the baby is on their bladder or kicking it or punching it, but you don't ever really know how it is that they know that. But for me, the way that it feels is, so picture when you have to pee, but it's the most you've had to pee ever in your life. You have to pee so badly that it's consuming you, okay? But you only feel it for this long. And I guess that's the best way I could describe knowing that my bladder must be getting danced on a little bit, because I just have this sudden, intense sensation that I have to pee, and then it goes away. Just a split second. And so in addition to the humming that was going on, I would also get these, you know, short little spurts of feeling like I had to pee, even though I kind of didn't have to. I mean, I'm sure I could have if I went, but it wasn't as urgent as it felt in, you know, the 5-minute or less span where she would kind of kick or punch my bladder a few times in a row. And actually, I just thought it was really cute. I don't know why. I know she doesn't know what she's doing. I know that's not, you know, something intentional on her part, but I don't know. I think everything she does is cute right now. If you couldn't tell from my week 27 update, I've been very emotional. It started probably that week, and I guess I didn't even really notice. Or maybe it was week 28, because I think that's when I filmed that video. But I've been having a lot of trouble not thinking of things that will make me sad on purpose. It's almost like when you sit down to watch a movie that you know is a sad movie. I'll sort of think of things that I know are going to upset me, and I kind of let myself think about them. Look, I'm starting to cry. I just have one example because it's the one that I wrote down in my notes, but because I work at home, I work for myself, I would allow myself naps pretty regularly. In times where I was really depressed, it was a lot of time napping, and I know that wasn't healthy. It was like 4 or 5 hours a day I would nap. Now it's more like between 20 to 45 minutes. And I've said to you guys in the past, if I was having a day where I was really, really tired, I just let myself sleep for as long as I felt I needed to. So, but I always set an alarm so I can kind of check, you know, wake up and see, do I feel good? And I'll get up. And my dog Lucy loves naps. She loves it. If you ask her if she wants to take a nappy, she runs right upstairs and gets in bed. If she hears me go in the bedroom, sometimes she gets excited and runs in there and just tries to anticipate if we're going to take a nap. And then when I get in bed, she waits to make sure, is this the real deal? And then she leaps. She always does this big jump over to where I am and crawls in the blanket behind me and curls up next to my back. And she'll like really nuzzle up against my back and sleep there the whole time. She loves taking naps. And I realized one day in week 28, and I know this in the back of my mind, I already know it, but it was like one day my brain decided to be a jerk and really send the message home that this is not gonna keep happening, and it's gonna be so rare. Why am I crying over this? I do. I love my little dog so much. Don't get me wrong, I love Bowser too, but I just have this bond with Lucy, and she has gotten me through some really hard times. and doing things that I know make her happy has gotten me through and made me happy in days when things are really hard. So I don't know, it's just sad to me that that's not something that we'll be doing anymore or very often, and I can't communicate that to her, you know, that it isn't because that I don't love her or whatever. Oh, I can't even think about it. All right, that's enough of that. You guys get what I'm saying. Another thing that I could say has been going on for a while, which I've probably mentioned before, but it's still the case, is that I have days. It's just so shocking to me that this is possible at this point, this far into things. I have days where I feel like a completely normal person, like nothing strange or wild or full of nature and wonder is going on in my body. I feel like just me. And then other days, and it really is, it's like a whole day I feel, or most of the day until bedtime, and then I start to get kind of achy and I can sort of feel that things are different. But most of the time I will have a whole day where it feels like I'm just me. Nothing new, nothing to see here. And then the next day I feel like I'm 80 years old. Everything hurts. My stomach feels huge and crampy and just so noticeable. And I don't know how I ever feel normal. And you know what? It's weird. It happens a lot on a Sunday, which is a day that I don't work because there's no mail service. So I just give myself that day off. So Sundays, Mike is home. He's here and he can help me with things like carrying the laundry or, you know, bringing something up or down the stairs for me that, I can't even think of what, but like the laundry, I suppose. He's here and he can help me, and we usually are either doing things together, like in the baby room or whatever, or relaxing. No matter what we're doing, I don't know if it's me, if it's like a mental thing, but it's almost like my body really relaxes on Sundays because I guess I feel like I don't have to keep things up and keep going and push through, but it doesn't even feel like pushing through. I feel fine. And then on Sundays, it's like my body just gets tired and needs a break, but it knows like, well, Mike's here, so he can help me with things, and I don't have to do it all, and I don't have to, I guess, just put up with the pain or the aches or whatever. But I would never say that any of it's even that bad. Like, I couldn't complain about anything. I had hemorrhoids for like a week, and that was in like week 14 or something. I seriously have been so fortunate. So, you know, those days I do. I feel my age. I feel exhausted. I feel terrified to have a toddler in a couple of years, and be even older and more tired. But honestly, it's just a day or two here and there. It happens where I can really feel the gravity of things and the changes in my body, and probably a little bit of the inflammation that's coming back and things like that. But I just find it so interesting how some days I feel totally fine and almost invincible, and then other days I just really just want to lay in bed all day long and not move. And the thought of going up and down the stairs, or even just bending over sometimes, if I'm being real, it's like, oh, I can't bend over right now. While I am talking about it, I guess I will show you my belly, because I'm pretty sure I forgot to take a picture until week 30. So I forgot in week 28 and 29. So I will just stand up and show you. I probably have cat hair all over my shirt, so enjoy. I feel like I can't get far enough away here, but there it is. You can see where it's nice and firm up top here, and where it's just like soft down here. That's just like loose skin and fat, so most of it's all right here. So probably the most exciting thing that happened, okay, not the most exciting thing, but something very exciting to me, was that, okay, I have been watching and sometimes rewatching, in the case of some people, friends of mine who have made pregnancy updates in the past. There's only a couple of people that I've watched that are more current, but I feel like everybody in the small handful of people that I have watched, has mentioned that they have started leaking colostrum in way earlier weeks, like as early as week 25. And I was almost kind of feeling disappointed that I haven't had anything like that going on. So one night when I was just sitting on the couch with Mike, it dawned on me, like, you're in week 28. Is anything going on down there? And I do have a big fear of having complications or the inability to breastfeed. I mean, among all the fears, because you guys know that I'm just so anxious all the time, such a nervous Nelly about things that could go wrong, and such a hypochondriac. But one of the things, just because I have PCOS and that has a tendency to cause problems when it comes to breastfeeding, one of the things I worry about is that. So I have read that not having any leaking or colostrum early doesn't mean you'll have problems. But to me, it feels like, yeah, but it doesn't really help my mental state, but having it not happen. I think in one of my pregnancy apps, it had just been a point of, you know, like one of those little tiny dialogue boxes that pops up for every day. It had just been one of the things that they mentioned. And even in that little blurb, it said, don't worry if it hasn't happened yet. That doesn't mean you will have trouble breastfeeding. But I decided, I turned the flashlight on my phone, and I pulled my bra down, and I shined the flashlight at my nipple, and I just squeezed at it because I thought, maybe something will happen. And it did. It did. I was just so excited. I don't know why I hadn't tried it before that. I guess I just assumed that I would have active leaking or like a sticky residue or something and it would be noticeable, but that's not really what my body is choosing to do, because even since then it hasn't really changed much. But I squeezed at one of my nipples and I did see clear fluid starting to come out, and I was so excited. And the other breast I was nervous about because I had previously had a piercing in that nipple. And I don't know if you know anything about people who have issues with piercings, but I had the same problem with my belly button. I had just not really like a full-blown keloid, but basically it's just something, my sister and I have both had issues with that over the years, that our piercings tend to result in keloids or just like excess lumpy scar tissue. And my nipple doesn't look really deformed or anything. My belly button does, unfortunately, but my nipple doesn't look really deformed or anything, and it doesn't have a lot of scar tissue from the piercing. But I thought, what if it's just enough to have messed up what I'm able to do with that side? So I squeezed at that one, just assuming nothing would happen, but that side, it worked on that side too. I was so overjoyed. It was just what a bizarre thing to have such a positive reaction from, but I was so thrilled. And I think I freaked Mike out a little bit because he was like, what are you doing? I didn't explain it to him first at all, but that was a pretty exciting moment. In week 28, I saw my doctor, and I'm seeing her every 2 weeks now. And I know that she's really watching me closely for changes in my blood pressure and protein in my urine, things like that. And then I just have a quick belly check where she checks for the heartbeat. And then every 4 weeks, I have a non-stress test and an ultrasound. So in week 28, I had the non-stress test and ultrasound. They were scheduled the same day, back to back. And basically a non-stress test is to monitor fetal movement and the heart rate for a 20-minute period of time. I guess that changes from person to person, and how often you go can change from person to person. I'm being led to believe that it might not be every 4 weeks. Eventually it might be as frequently as every week. So pretty much there are 2 monitors strapped on. Ooh, she knows I'm talking about her. She's doing somersaults today or something. One of the monitors picks up on the heartbeat, and then the other is more of a silent, I don't know. She didn't explain it thoroughly. She basically just said that picks up on movements. So they're looking for certain reactions and changes in the heart rate based on what the movement is at the time, and I'm supposed to push a little button with my thumb every time I feel her moving so that they can check the chart on the screen. And so she said, push this every time you feel movement. And honestly, that day I had barely felt anything. So I said to her, I was like, I don't know how much she's gonna move today because she barely has at all. So they had this little device that she put on my stomach that made this loud, awful buzzer sound, and that woke her up and that got her moving. In fact, I think it upset her so much that when we went in for the ultrasound, she was kind of like trying to cover her face completely. The ultrasound was supposed to be sort of a follow-up anatomy scan because I haven't had a really good, there hasn't been anything that was concerning, but we have had some times where the pictures didn't come out well enough, especially for some of her organs and some of the more vital measurements. It just, the pictures weren't great. And they said that she was transverse. It was the longest and most disappointing ultrasound of all. And of course, there's ways that it could have been much more disappointing than what I'm saying, so please don't mistake that. Please don't. I know how it can be to feel sensitive to something somebody said. And listen, it could have been way, way, way worse. So don't take that the wrong way. But I'm saying, when you're talking in terms of everything being great, everything being okay, and she's healthy and she's with us and everything, but just, you know, for the purposes of getting the ultrasound and then seeing your little one, it didn't go well. And this little tech, she was this little tiny thing, but she was grinding on my belly with that thing, the wand, whatever you call it, so hard. It was so uncomfortable, and the baby just didn't want to move. Her feet were up by her head, and she was kind of covering her face, and she was transverse, so they were saying that her head was sort of on my left side, and then her feet and the rest of her body was going across my belly, but her feet were folded back up towards her face. And I did post a picture on Instagram that we got that day of just how close her foot was to her face. And then the next day I had an appointment with my OB for one of my 2-week appointments, and she did confirm that she was transverse, but it was like she moved again, because that day she found her heartbeat on my lower right side, and then she was really grabbing at sort of a lumpy spot up towards my rib cage, and she was like, oh, that's her little tushy right there. So I guess she was still across my belly, but sort of at a diagonal, and her butt was up by my ribs and her head was a little bit lower. And I said, oh, maybe, do you think maybe she's flipping? And the doctor said, it's too early to really worry about that, so don't worry about that. But I do. She also set me up to take my next 1-hour glucose test. I did one at around 26 weeks, and she had me do another one at 28 weeks. So they gave me the drink and the lab slip for that at that appointment, and told me to just go at my convenience. And I did that in week 29. I'll talk to you guys more about that in my next video. Then she gave me my flu shot. I had a flu shot and my Tdap vaccination, and I thought the nurse put them in the wrong arms, because she said she'd put the flu shot in my dominant hand on my right side, and then she'd put the Tdap on the other side because it tends to hurt a little bit more. And a few hours later, the only one that I could feel was the flu shot, and I was like, oh, I think she did it wrong. No, she did it right. At 2 or 3 in the morning when I got up to pee, I went to sort of push myself up off the bed with my left arm, and it felt like there was a softball in my arm. So she did it right. But I've got that all taken care of now, so I don't have to worry about it. I guess that is pretty much it for week 28. I have started to receive some shower gifts. I still can't believe it. So in case you're not familiar, my friend Lisa Marie TTC, is part of a group. It's a private Facebook group that throws online baby showers for YouTube mamas, and it's usually for women who have been making updates, and their stories are stories you've become invested in, and they would always feel, you know, over the years that they wanted to recognize these women and throw them a little shower, since we all obviously can't be in the same place at the same time. And it's something that I've done for years now. I think it's been like 3, possibly 4 years that I've been a part of it and sending shower gifts out. So you go to the online registry or wish list and purchase a gift, and it gets shipped directly to the mom-to-be's home. And then she has a predetermined date where she opens the gifts and has sort of like an unboxing and an online baby shower. And one of the most recent ones was my friend Meg from Smarty and Stevo. And I don't know if you have seen her YouTube shower, but I'll link that below if you'd like to watch it. I know a lot of people really like those types of videos. And my online shower is going to be on November 10th. And some of the boxes have started to come in, and Amazon is supposed to mark when it's a gift. It's supposed to say on the label, because when you purchase it off of a registry, from Amazon specifically, for example, because that's what people usually use, it marks it as a gift on the shipping label. But they've been slacking lately, I guess, and I order a lot of stuff from Amazon for my business and for my home. So sometimes I'll just be routinely going through and trying to just open my mail, and I'll open a box and I'll see for like a split second that it's not something I ordered, and it was something that was on my registry. And I close the box up really fast and I tape it back closed, and then I start crying. It's just such a beautiful thing. It means so much to us. And so I've started to put all of those in her nursery, in one of the corners of the nursery, and I think I might film the unboxing in there. And I just thank you. To anyone who has sent something, thank you. And to anyone who just watches these videos, and for your sweet comments every week. And I know I talked about it a little bit last week, but I have put some really terrible times out there into the world, and I don't even like to think about what's out there or what my past videos are like and what I'm saying and doing, because it's just such a dark, awful place. But I know it helps some people, as hard as it is for all of the most horrible days of our lives in our marriage to be out there on the internet for people to hear about our pain and our struggle. That's really hard to do. But anytime any of you reaches out, any of you who are struggling, and some of you, I know you still are, and it's so hard. It's so hard to know, because I know how it feels. And everyone's story is so different, but the pain is the same. But that's why this community is so amazing, is that people do spread so much love, and there's so much appreciation and understanding for where everyone comes from. So the fact that you guys are here, and you have been here, and that you have been rooting for us, along with some other really amazing women who've been putting their stories out there, I'm so proud to be a part of this community. And I just thank you so much for being here. I thank you for being part of it and for supporting everyone. And I have a short list of people that I know watch these videos and that I know have supported us over all this time. And just in the back of my mind, I think about you, and I think about how much I can't wait to hear that it's your time, and that you know all the joy and all of the stress. I long for the day that every single one of you gets to where you want to be, and you have the family that you've always dreamed of. And if there was anything that I could do to help make that possible by sharing anything that has happened to us or that we have done, I hope that I'm able to do it. I hope that anything I can share that could be helpful helps. And that's all that matters. So thank you so much for watching, and for being here, and for your supportive comments. And don't forget to tell us when you get your baby or your rainbow baby and you're in the same place, because even if you don't make videos yourself, some of you have such a big presence here, and so many of us in the community know exactly who you are and have so much love for you. So, and that is it for week 28. Thank you so much for watching, guys, and I'll talk to you soon. Bye.